Think Kegels are the only way to fix pelvic organ prolapse? Think again. Today, I'm going to show you 3 simple, safe, and effective exercises that you can do that aren't Kegel exercises. If you've been struggling with pelvic organ prolapse and you have been to maybe see a pelvic floor physical therapist who has recommended Kegels and you feel like your symptoms are just getting worse after doing them, there's definitely a reason why. We're going to discuss what's going on with your pelvic organ prolapse, as well as why these exercises are going to work. And then at the end of the video, we'll demonstrate these exercises for you. I'm Dr. Amy, and we are empowering women with changing bodies to move pain-free. I have a PhD in orthopedic manual physical therapy and strongly believe that movement is life, because both are possible. Let's start off with defining what is a pelvic organ prolapse. So that's when one of the organs in your abdominal cavity, so it can be the bladder, it can be the uterus, is bulging into the pelvic floor. You can actually feel this when you're washing down there, and you can feel that bulge coming through. That's how people first notice it most commonly. Although some people do have a sensation of a pressure or a fullness whenever they're standing and walking. So what causes it? Often it's caused during childbirth or after childbirth, and people notice it either when they're pregnant and it doesn't resolve with childbirth, or they notice it after childbirth because of the straining of pushing the baby out. Which also means that if you suffer with chronic constipation, this can cause it from that constant straining of trying to defecate. If you're someone who sits for a living, it could be due to poor postural support and that you're slumping down and putting increased pressure on that pelvic floor. And if you're a woman in that perimenopause, menopause phase of life, it can be due to hormonal shifting and a thinning that happens in the pelvic floor. At any stage of life, if you find that you have a weak or dysfunctional pelvic floor or core due to any reason, that can be postural, that can be overuse, then you may find that that leads to a pelvic organ prolapse. So why don't Kegels work for a pelvic organ prolapse? Well, what happens is that most people who are suffering with a pelvic organ prolapse actually have an overuse of their pelvic floor. Their pelvic floor is tight, not necessarily weak. So then you try to do a Kegel exercise and you've got these tight muscles that are fully engaged already, and then you're trying to squeeze them more. Well, I mean, they're like, that's it. They're at their end range of motion. Now you're trying to squeeze it even more, and the body's like, I can't do that. So it just like tightens up a little bit more. Well, what that can do is then pull on those organs and bring them down into the pelvic floor. Another thing that can happen is if Kegels are done incorrectly, it increases the abdominal pressure. So you have your diaphragm at the top of that abdomen, you have your pelvic floor at the bottom, and it's almost kind of like a soda pop can in that creates the top and the bottom. So if you are not doing Kegel exercises correctly, that actually increases the pressure and can put abnormal pressure on the pelvic floor. So true healing of a pelvic organ prolapse requires everything to be working correctly together. So you need to have your core working correctly, which includes the abdominals, the glutes, and the pelvic floor, including the low back muscles, because that's part of your core as well. You need to have proper alignment to make sure that all of these muscles are able to function correctly, as well as proper breathing, so you're not increasing your intra-abdominal pressure. And of course, posture plays a role, because we need to make sure that we're staying in that good posture throughout the day. And that is head over shoulders and shoulders over hips. And if you're standing, your hips need to be right over your feet. Okay, so I'm going to describe the exercises and why they're important before I demonstrate them, because it's really important to understand what the goal is of each exercise. At least I believe it is, because that makes it easier to do the exercise correctly. First off, we're going to work on deep breathing with core activation. And when we're talking about the core in this case, we're going to be talking about the abdominals. So we want to make sure that we're doing that deep breathing. We're using the diaphragm, so we're not increasing the intra-abdominal pressure. And then at the end, we're going to contract those abdominals to help get them to function better. Now, I don't like to start with abdominal work that is like crunches or sit-ups or something like that, because a lot of people can't even activate their abdominals. They end up doing those exercises exercises incorrectly and using other muscles like their hip flexors or something like that. So we want to make sure that we're learning how to actually actively contract our abdominals without causing increased abdominal pressure. And if that sounds impossible, then this exercise is going to be for you. The next thing we're going to work on is glute squeezes. So we want to activate our glutes without activating all the other muscles. So a lot of people, when they try to do glute squeezes, will actually end up squeezing all the muscles in their lower extremity, including their quads on the front of the thigh and the hamstrings on the back of the thigh, and they can't actually activate their glute, which means when they're doing functional activities such as walking or running or exercising, they're going to compensate with those other bigger muscles instead of actually activating those glutes. So being able to glute squeeze and hold a glute squeeze is critically important to get those glutes to activate during regular activities. And then to make it functional, we are going to put all of that together. So we're going to do deep breathing, we're going to do abdominal contraction, and we're going to do glute squeezes without relying on the dominance of the other muscles to get that core, because again, the core is the abdominals, it's the pelvic floor, and it's the low back, and it includes the hips too, to make sure everything's working correctly so that when you're doing your day-to-day activities, you have that full active engagement and you're not having too much stress put on one area, such as the pelvic floor. So we're going to go ahead and demonstrate all those exercises for you now, and then on the back end, we'll talk about some more tips and things you need to be watching for during your daily activities. Okay, so first off, we're going to start with the deep breathing with the abdominal contraction at the end. So in the beginning, as we're doing that deep breath, we're going to make that big belly breath. We're going to let that belly really expand, which means the abdominals have to relax. And then as we're breathing out, we're going to contract the abdominals slowly so that at the end we have that good abdominal contraction. Now I'm going to put one hand on my belly so you can kind of watch that. I know it's a very slight motion and it is going to be difficult to see, but I'm hoping that that will help give you an idea of what's happening. And at the end, I'll kind of do that squeeze so you can kind of see. I know it's my hand that's doing it, but it's actually my abdominals that are doing it. All right, here we go. So deep breath in, you're going to breathe in through your nose and you're going to breathe out through your mouth like you're blowing out a birthday candle. So deep breath in. And out. Really squeeze at the end. Deep breath in. With that squeeze at the end. Now, what I want you to notice is when I'm doing that breathing, we're not getting motion that's happening through here. So we're not trying to squeeze at the end and tilt. I don't like to do that tilt with it. We want to keep that lumbar spine, that low back, in that neutral position. So I'm going to do it one more time so you can watch how my back is staying in that neutral for me position. And again, I know it's a slight motion, so it's difficult to see, but I really want to emphasize, we're not trying to do that tilt. That should not be happening while you're doing it. That does engage the abdominals. However, that's not the goal of this exercise. All right, next up, we're going to do glute squeezes, and we're going to do it laying down because we're already in that position, and also the next exercise is in that position. But to be fair, you can do glute squeezes in sitting, and you can also do them in standing. However, if you're not familiar with glute squeezes, I definitely recommend starting in this position because it'll really help you to discern if you're using other muscles instead of just your glutes. So with a glute squeeze, what you're going to do is you're going to squeeze your cheeks together like you're trying to hold everything in, right? But not a Kegel. You're not trying to squeeze that pelvic floor up. Pelvic floor is here going up, right? We're trying to squeeze these cheeks together there. Again, I know it's a small motion and it's difficult to see, but let me show you what that looks like. We're then going to hold it for 5 to 10 seconds, relax for 5 to 10 seconds, and then we'll do it again. So we're going to squeeze those cheeks together. And the goal is not to be relying on the hamstrings to do that, although the hamstrings will activate. So people will say, like, do a glute squeeze and don't activate your hamstrings. Well, I mean, they're they're going to be active. Whenever you squeeze your glutes, your hamstrings are going to activate. But you don't want to be trying to kind of squeeze those hamstrings and really lifting everything up. Again, that's not the goal. The goal is to squeeze the cheeks together, not lift up yet. We're going to do the bridge in a second, but that's going to be a different way of doing it. So we're going to squeeze those cheeks together. We're going to hold for 5 seconds. And then we're going to relax. So however long you hold is how long you're going to relax, and you're going to do 10 reps total. Okay, so now we're going to put all of those together. So make sure that you're really comfortable with the first 2 steps. You want to make sure that you can do that deep breathing with that abdominal contraction, and then also that you can do the glute squeezes as well, because we're going to put all those together to form that bridge. Now, a lot of people have been taught to do bridges by rolling up like this, which causes a change in how the low back or the lumbar spine is moving. That's not what I want you to do right now. That's not necessarily a bad exercise, but that's not the goal for what we're working on right now. What I want you to do right now is more of a hinge through the hips so that that low back stays in your neutral position. So we're not trying to roll. That's a different exercise. It's more of a hinge that we're trying to do. Okay, here's what it looks like. I always start with the deep breathing aspect first to kind of get myself warmed up. Now, as I squeeze those abs, I'm going to lift up with those glutes. And you can see my glutes are shaking a little bit because I already worked out this morning and I hit my glutes really, really hard. So you can see how powerful of an exercise that is, even though it looks very, very simple. But when you're actually engaging those muscles correctly, it's a super powerful exercise and a really great workout. All right, so if you found those exercises helpful, please give us a like. Don't forget to subscribe for more women's health content. But I want to go into a couple more tips that are going to be super helpful for you if you're suffering with a pelvic organ prolapse. First thing is I need to make sure that you're focused on your alignment when you're sitting as well as when you're standing. So again, that is the head over the shoulders and the shoulders over the hips. It's important to be in good alignment to decrease stress to the pelvic floor. Next thing is we need to work on those bowel movements. So we need to make sure that we're not having to strain consistently and put increased pressure on that pelvic floor on a regular basis. Now, there can be a lot of reasons why people suffer with constipation. It can be the food that you're eating. It can be that you're not getting enough fiber. It could be that you're not drinking enough water. And many people ask me, what is enough water? So on a basic level, the minimum amount of water you need to be drinking every day is 80 ounces. And for some people, that is a shockingly large number. For some people, that's actually a low number, and they find themselves drinking more like 100, 120, or 140 ounces a day, which is fine as long as you are exercising regularly to help your body process that. But if you're suffering with constipation, minimum of 80 ounces, I guarantee you it'll change your life. You also want to minimize high impact activities early on. So things like running and jumping or rope jumping can be difficult activities when you're beginning to suffer with a prolapse. So you want to think of more gentle activities that aren't so aggressive. Things like the elliptical, even walking on the treadmill, or even walking outside can be very helpful, or swimming for your cardiovascular activity to make sure that you're not putting too much stress on that pelvic floor while it's trying to heal. The other thing I would like you to consider is seeing a pelvic floor physical therapist to help assess your specific condition, because every body is different and you may have some other issues going on that are increasing your risk of prolapse or causing your prolapse to continue for longer. So if you'd like to learn more about online health coaching, I'm going to have you reach out to Concierge, that's CONCIERGE at pt4eb.com. If you're suffering with pelvic pain or you'd like to learn more about how to fix pelvic organ prolapse, I'm going to have you download our free ebook here. And if you're looking for my #1 exercise to do instead of Kegel exercises, which we did not cover here, I'm going to have you go watch this video over here.